Sports, Gildan, Pacific, OGIO, and many more. At LTS, screen printing embroidery is done in-house and we guarantee customer satisfaction. Stop by, give us a call, or check us out on the web at shoplts.com. Remember the name, LTS.
Ocala's information station, 1370 WOCA. Ocala!
All right, 3 minutes after 11 o'clock. Thank you for tuning in this Wednesday morning. You know, one of the maybe the second scariest, maybe the scariest word in our language is heart surgery. That's a pretty scary word. Dr. Scott C. Schultz is on the phone with Yarro Babb. Dr. Schultz is a cardiothoracic surgeon and the medical director of the cardiovascular surgery at McLeod Regional Medical Center. And Yarro Babb is a physician's assistant who assists in open heart surgery cases with Dr. Schultz. National Physicians Assistants Week is this week, October 6th. It started yesterday. It runs through October 12th. And they're on the air to answer some questions that we may have and to talk about the endoscopic vessel harvesting, which is a step performed right before open heart surgery. Wow, vessel harvesting. That's kind of a scary word, or a group of words as well. Dr. Scott Schultz and Yarro Babb, good morning to both of you.
Good morning, sir.
Good morning.
Where are you guys? Where are you calling from?
We're in Florence, South Carolina.
Oh my goodness, are you in the floods?
Well, we actually avoided it. It's the area most affected was about an hour south of us.
Oh my goodness! Wow. Yeah. Well, thank you for being on the air with us. Are you both in the same hospital right now? Are you in a hospital?
We are. We're at McLeod Regional Medical Center.
Oh, okay. And that's in Florence.
That's correct.
Oh, okay. What is? I could guess what vessel harvesting is, but what is it?
Well, vessel harvesting is where we obtain a conduit or a tube, which is a vein or an artery from the patient's body, usually the arm or the leg, and we take that and prepare it for use to construct bypasses around blockages in the patient's coronary arteries that supply blood to their heart muscle.
Oh, and gosh, I would have guessed right. I sort of kind of thought that might be what it was. Have we needed to do that less because of the stents?
Heart disease is still the most prevalent major disease in this country. It's the #1 killer in this country. We've made a lot of advances in patient education, diet, medications, angioplasty, and stenting. And as a result of that, the number of bypasses done in this country has fallen over the past 10 years at the rate of about 1% per year. We're still performing about 350,000 of these procedures annually.
Wow.
So it's still a significant problem. You started out your show saying it's a scary words to hear.
Yeah.
And really the way that I approach this and the way I approach it with my patients is I tell them in most cases we're dealing with a treatable problem. Yes, it's a significant problem, but I'm not here to tell my patients or tell them that they have a terminal problem. You have a bad problem, but we have a good solution, and that good solution is heart bypass surgery.
And I've known a few people who've had open heart surgery. I don't know if they've all been bypassed, but they've either had stents or some kind of a bypass. And one guy I know I think he had 3 valves that were replaced or repaired or something. But they're all doing so well. Maybe that's the bottom line of what I wanted to say. We must have gotten to the point where, not that we should take it for granted, but it seems like it's a very successful field.
We have made a lot of strides in heart surgery. The first bypass procedure was performed actually in the late 1960s. But it's been revolutionized since that period. And over the past several years, there's been some advances made. We try to do it less invasive, as least invasive as possible. And one of the advances over the past decade has been the advancement in the endoscopic vessel harvesting technique, which Yarro, my PA, can explain in detail.
Yeah, can I ask a question about that? Why, if we have poor eating habits, and we always hear that eating habits will cause our veins and arteries to be clogged up. Why would the legs be spared that? Why would the veins in the legs be spared?
Well, you're talking about arteries versus veins. The arteries are what take the blood from the heart to the tissue or to the organ, and the veins return the blood. And the arteries are subjected to higher pressures, more stress, and as a result of that, they become damaged much more frequently than the veins. The veins actually do not clog up with the atherosclerotic or the hardening of the arteries that you hear.
Oh, really?
The veins are not involved. The veins can be involved with blood clots, but that's completely separate and unrelated to the heart disease that you're referring to.
Oh, okay. Well, gosh, I never had that explained before. Yarro, are you the guy who goes into my leg, and hope it's never me, but are you the one who goes into the leg or the arm and gets the vessel?
That would be me. Typically, what we do is we use an endoscope, which is a lighted wand with a camera at the end, and we make a small 1-inch incision on the patient's leg and harvest the vein. We take the appropriate length of vein, anywhere from 8 to probably 30 inches,
wow,
depending on how many bypasses we're going to need to do. But it's all done through one, occasionally 2 small 1-inch incisions. This is in contrast to what they did in the 60s, 70s, and 80s, which involved an incision from the groin all the way to the ankle. So what we do now and have done for the last 10 or 12 years is much less invasive. It allows patients to have a better cosmetic result. It allows them to walk sooner after surgery, and it's certainly less painful for them.
Yeah, well, why is a vein that long dispensable like that? How can we live without that vein?
Well, the good news is in your leg you have several veins. Some you see, some you don't. Some are what we call superficial, and some are deep. The superficial veins, we can sacrifice, or we can remove those with very little consequence. And the deeper veins take the blood from the leg or from the lower extremity back to the heart once those superficial veins are removed with no sequelae.
So the part of this that so far I don't understand, maybe I need to have it said again, it just didn't sink in, is why is this different than, I don't know if we call it the old type of harvesting procedure? Why is EVH different?
Well, let me help you understand that. The old style, the original description is making an incision, if you can picture this, from your groin all the way down to the ankle on the inside of the leg. One
big line, one big cut?
One big incision from the groin to the ankle.
Oh.
The endoscopic method now allows us to take out this same length of vein, if that entire length is needed, with 1 or 2 1-inch incisions.
Okay.
That's it.
Okay.
So the wound healing is dramatically improved, the cosmetics are improved, patient satisfaction, and so forth.
Oh, okay. And does the patient have to be fit? Or you know, I mean, everybody's not all that fit as other people.
Well, the good news is, you know, the vein on the inside, despite what the outside looks like, the vein on the inside tends to be pretty consistent. And so this technique can be used on everybody unless they've had their vein removed for one reason or another, sometimes cosmetic reasons, sometimes medical reasons, or sometimes people have had blood clots in their leg, at which time we wouldn't use the vein.
I gotcha. So how much time is there between the time you harvest the vein and the time you do the heart surgery?
The procedures are actually done simultaneous.
Oh, okay.
While my assistant is working to remove the vein from the leg, the surgeon is up in the chest area preparing the heart for the heart bypass procedure, and that entails making an incision through the skin, sawing through the breastbone, and oftentimes putting the patient on the heart-lung machine so that the procedure can be done safely.
It's just amazing that you guys can do that. So the heart surgery is always done that way. We don't go through the tiny little holes.
We don't do that very often, and some of us, myself included, do the heart bypass procedure without the heart-lung machine, so we do it on a beating heart. We still favor the incision through the breastbone, through the sternum, Occasionally, if one artery needs to be bypassed, we can make smaller incisions and avoid the breastbone. But the average number of bypasses we do per patient is a little bit over 3 bypasses per patient. And with that many, there's not an effective way to expose or get to the heart other than through the breastbone. And it sounds like a very invasive procedure, which it is. The good news is it's a very well-tolerated incision. We stabilize the bone after the surgery with stainless steel wire, and the patients are up walking the day after surgery. And quite frankly, the incision through the breastbone is actually better tolerated than incision into the abdomen or below the diaphragm to gain access, say, to the colon or to the stomach or something like that.
Wow. By being on this radio station, I just want to point something out, and I don't think I've ever pointed this out to any guest ever before, but in your case, you're talking to a unique type of demographic, because we have here a lot of retirees who just may be perfect candidates for what you're talking about, but we also broadcast to the University of Florida. And there are probably a lot of students listening in who may be considering going in this direction as far as a career, whether it's to be a surgeon or a physician's assistant or something similar to those things. So I'm going to ask for information for both those groups. Is it the same website for both the folks who might be patients and the folks who might be students?
Well, if your patients want to gain better understanding of the procedure, and even students, if they're interested, they can go to myheartbypasssurgery.com, which will give them additional information about the procedure itself. In terms of the actual training process and how to become, say, a physician's assistant, for example, there is a national website. It's aapa.org.
Okay.
They can learn more about becoming a physician assistant if they so desire.
Okay. All right. Thank you for that information. Dr. Scott Schultz and Yarro Babb, thank you both for what you're doing, and keep it up. Thank you for being on the air with us.
Thank you for having us this morning.
You're welcome. All right, we'll be right back.
Safe boating is no accident. Partly sunny today. There can be a shower with thunderstorm right along the beaches, the high 82 to 86. And partly cloudy tonight. Again, there can be a brief shower or two at the coast. Overnight, those 67 inland, 72 on the coast. For tomorrow, times of clouds and sun with a shower with thunderstorm mainly in the afternoon, high 84 to 88. For Friday, intervals of clouds and sun with a shower with thunderstorm in the afternoon, high 84 to 88.